The journey through infertility can be a long road. Roughly 75% of couples conceive within the first year of trying. But for those who are not as lucky, it can be a very emotional time. And here with me is Dr. Austin. He works at the Fertility Center of Oregon, and he is here to answer some of the most frequently asked questions. So Dr. Austin, how does a person know if they are infertile and what actually causes it?
Yeah, great question. So generally people have to try to get pregnant to find out that they are infertile. We would recommend that women below the age of 35 would try for a year to try to conceive unless there's an obvious problem. For instance, if they're not cycling regularly, we would begin the intervention earlier than that. For women over the age of 35, because time can be of the essence in terms of female fertility, we would recommend that they try for 6 months. And if they haven't conceived after that period of time, that they would seek consultation both to look for diagnostic causes and also to begin therapy. The most common causes of infertility have to do with a woman and her cycle. So they're split between both ovulatory problems, cycles that are not occurring regularly or in which there's not good ovulation, and also anatomical problems. The anatomical problems generally have to do with the uterus or the fallopian tubes, and they can be either inborn or congenital abnormalities, or they can be acquired. About a third of the time, the cause of infertility is male factor. So either poor quality or poor numbers of sperm. And about 10% of the time after an extensive evaluation, we don't find a good reason, and those people are termed to have unexplained infertility.
When people start their fertility treatments here, what does that look like?
It has a myriad of different appearances, but essentially what we're trying to do is come up with a treatment plan to address what the problem is. For men, if they have low numbers of sperm or the sperm are not functioning very well, we often would begin doing something called intrauterine insemination, which is boosting the sperm in the female reproductive system. Occasionally, men will have such severe impairment of sperm that we have to use in vitro fertilization technology to affect fertilization. Women often may have ovulatory problems, and we have both oral agents, pill forms of medication to induce ovulation, as well as injectable forms as well. Additionally, some women may need to have surgical diagnostic studies in terms of a laparoscopy that can help to clear the pathway or facilitate sperm and egg getting together in the fallopian tubes. In general, there is something to be done for any couple who comes to see us to improve their fertility.
What advice do you have for patients to maximize their visits?
We have a whole process when someone is making an appointment to see us, and that is really important that we gather the information that is necessary to make good use of that time. Our questionnaire has a lot to do with their history, both their developmental history as well as any treatment that's been done. We don't want to have to replicate or redo any of the previous investigation. This is, of course, one of the most stressful situations that young people encounter, and because of that, we know that distress causes a worsening of fertility. So we teach people and partner with them in ways to minimize the distress that comes from infertility, to maximize the opportunity for success.
So you probably get this a lot. How successful are these fertility treatments?
Quite successful. If we're able to use all of the techniques that we have, and we're not limited by time or resources, generally 90% of the couples who come in for fertility investigation will leave with a baby. One of the difficulties, however, is in the state of Oregon, a lot of people do not have insurance coverage for infertility, and because of that, resources are sometimes limited. At the Fertility Center, we make every effort we can to facilitate people's excellent and comprehensive treatment so that they have the maximum chance of being successful.
Thanks for joining us. Make sure to subscribe to our Women's Care YouTube channel, and you can find additional resources on fertilitycenteroforegon.com.
Thanks very much for joining us, and I hope to see you in the office soon.